Sharing some tips with you this morning as to those of us at higher risk of getting breast cancer. So chances are you know someone who has or had or worse passed away from breast cancer. So in light of this month of awareness, we're encouraging you to stay abreast and to get checked. We've got gynecologist Dr. Melissa Forbes Gabadon. Yes, Gabadon? On
Yes, that's
Zoom
correct.
to talk us through a few things that we need to know before going to get that mammogram. Morning, Doc. Thank you for joining us this morning.
Good morning. It's such a privilege to share with you on such an important issue. Certainly, breast self-awareness and, of course, the annual mammogram are critical in terms of early detection, which could potentially save many lives.
Yes, we are so used to hearing that phrase. Early detection can save your life, yet so many of us are scared stiff when the time comes around to go and get ourselves checked, especially where this mammogram is concerned. So you want to give us some tips this morning that will help us, I don't know if it's calm down or be at a little more ease, because generally it's an anxiety-producing and anxiety-inducing event.
Most definitely.
Naturally, because we understand that, right?
Mhm.
But what would you say to the woman, Doc, who perhaps has never done this before for fear of fear?
So certainly, once you're age 40 or older, it's recommended that you get your annual mammogram. And it's okay, if you've missed the first few, it's just important to go ahead and get it done. So, absolutely, there's a lot of fear and anxiety associated with it. And there are a few things to keep in mind once you're going in for your first mammogram. So first of all, go with an open mind. It doesn't make sense to worry about things that we have little to no control over. And, knowing is half the battle. So as hard as it is to say, not to worry and not to fret about it before, you just want to go with an open mind. Just know that, you're doing this for your health. It's just one of those things that we go through. We get it out of the way for the year. And then, we keep up with it annually. In terms of preparation, you ideally want to wear either a top and pants or a top and a skirt, simply because you'll be required to remove any clothing above the waist. So clothing and jewelry would have to be removed. So ideally, you want to wear something that you can be comfortable in, and you want to be able to wear a top that's easily removed. On the day of your mammogram, you also want to avoid wearing deodorant or putting on any powder above the waist, simply because that can sometimes affect the x-ray. It can show up on the x-ray and make it a bit more difficult to be read. So ideally, you want to avoid deodorant on the morning of or day of your examination, but you can always walk with it and apply it afterwards, so
Difficult to
that's
be
fine.
read, Doc, because it may show up as something that may look suspect and affect the reading in that way.
Right, that's correct. So basically, like powder or some deodorants, depending on how thick you apply it, it can actually show up on the X-ray, especially because they're looking at both the breast and the armpits. So that's why it's recommended that you not apply it on the just before the mammogram.
Okay.
Also, you want to ensure that you are, well, this is a tip I give my patients. So, part of the mammogram is that there's an area of the breast that will have to be compressed for them to do the x-ray. And that compression can be, very uncomfortable. I don't want to use the word painful, but it can be quite uncomfortable. So to help minimize that, you want to ideally schedule a mammogram for probably the week after your period ends. Reason being that the breasts are a little less tender at that time of your cycle. So just to kind of minimize the discomfort that you would experience, it's best to schedule it about 7 to 10 days after your last period. As well as what another trick that I give my patients is that you can take a dose of pain medication on the day of your test. So that also helps to minimize some of the discomfort that you may feel at the time. Outside of that, if you may be pregnant or breastfeeding, it's probably best for you to postpone your appointment, just because that can also affect how easy it is to read the mammogram if you're breastfeeding. And of course, the compression itself, that's probably likely to be the discomfort is likely to be more pronounced if you are breastfeeding, as well as you don't want to, if you're pregnant, you don't want to expose the baby to any unnecessary radiation during that time. So you can inform your doctor if if pregnancy is a possibility or if you're breastfeeding, so that we can advise you on how to schedule the mammogram in those situations.
Doc, is there someone who's more predisposed to pain? Smaller breasted women as opposed to bigger breasted women, women with more fatty breasts as opposed to dense breasts? Yes, go ahead.
So it tends to vary based on individuals. So pretty much some women experience more pain at certain times of their cycle. And, this may be whether she has larger or smaller breasts. So, pain is very, very subjective. So it's difficult to say who is likely to have more pain. Certainly the thought is that if you have more breast tissue to be compressed, it's likely to be more uncomfortable. But even women with smaller breasts can still experience, a little bit of discomfort at the time, but it's not anything life-threatening. And as I say, you can take your pain medication on the day of it and just prepare your mind for a little bit of discomfort, but this little bit of discomfort could potentially save your life.
Yeah,
so
for sure.
Kind of look at big picture.
For sure. It says, discuss any recent changes or problems in your breasts with your healthcare provider before getting the mammogram, which would refer to the importance of self-checking before you get there. So you want to be able to feel around and see if there's anything that feels anomalous to you. That's important before you go in, right?
Right, because that would determine the type of mammogram that you get. So technically there are two types. There is a screening mammogram, which is a regular standard mammogram that we do for women who have no complaints at that time. However, if we know that there is already a lump there or a problem or a potential problem there, then you would likely get what's called a diagnostic mammogram, which is a little more detailed. So that's why you'd want to bring it to the attention of your doctor beforehand so that we can advise on what test would be the best to assess.
And I think it's also important to tell ladies that based on what your mammogram shows, you may be asked to do an ultrasound after, right?
Exactly. So for younger women who have a bit more fibrous tissue in the breasts as opposed to fat, the breasts are considered what's called dense. So dense breasts on mammogram, sometimes it's a bit more difficult to interpret. So to help with the overall assessment, an ultrasound may be requested afterwards, just to give us that additional information that's needed to make a clear assessment of the breasts.
Okay. So yes, it is anxiety inducing, but just prepare your mind. You say go with an open mind. And don't stress about it too much because the real stress comes from not knowing, right, Doc?
Exactly.
Yeah, and finding out early can really be the game changer for you.
Yes, it has a very good chance of reducing your chance of actually dying from cancer if we're able to detect it early on. So, that's why the mammogram and breast self-awareness, they're so critical in terms of reducing your risk of actually dying from breast cancer, which is the leading cause of cancer-related deaths in Jamaican women at this time.
Yeah. We spoke to the doctor last week who was telling us last year, I think we had 1,200 cases and 600 of those cases ended in death. So ladies, we have to go and check. We have to go and check and see what's going on. It is critical. I've done it. I will be doing mine. I do mine every year.
Excellent.
Doc, no pain, just a little uncomfortable, but no pain. So don't allow the fear of the mammogram itself to stop you from going and getting yourself checked out. Appreciate it this morning, Doc. Really. Thank you for your insight.
Thank you so much for having me. It was a pleasure.
Good to have had you. Gynecologist, Dr. Melissa Forbes-Gabadon. Take a break on Smile, everybody. We get our update on the news in 5 after this.
You are a fighter. You are a survivor. You are braver than you think.
Celebrate all victories and do something fun.
Eat healthily. Stay hydrated. Listen to your body.
And remember, it is important to be kind to yourself.
Meditate, visualize, and laugh.
Have patience.